I'm Loretta Johnson, and I am 62 years old, and I do not have health insurance. My husband was a certified welder, so, you know, we did pretty good for a while until he got sick. He had open heart surgery, and he was a diabetic, and then had a stroke. And I chose to give my job up to stay home and take care of my husband until he passed away 4 years ago. So you're in your late 50s with nothing because of choices that I made to help other people.
The facts are pretty straightforward. Medicare is a good program, but it's in trouble.
If we don't do something now, and you like what you have, you might not be able to keep it. And it may be next month, 2 months from now, next year, and you never know. And that lack of security should scare you.
Status quo is not an option. We have to have health care reform.
Even with coverage, seniors have to stretch their medicine. Seniors, some of them can't go to the doctor because they don't have the income to go to doctors.
Seniors pay for a significant part of the program, and those premiums will continue to go up and put a real pinch on seniors' budgets if nothing is done.
And if there's any concern about what's going on with healthcare right now, it's this donut hole, with seniors and medications. This idea that once you get to a certain level, a certain amount of money that you're spending, then all of a sudden your costs go up.
I know seniors who have cut medicine in half to make it last 2 months as opposed to 1 month. That's dangerous.
When I see in the bill that they're going to eliminate my donut hole, it's automatic. How could I be against it?
There are proposals currently working their way through the legislature that are addressing the long-term needs, and I don't think most seniors realize the need for long-term care.
We ended up having to make the very difficult decision to move my 64-year-old dad into a skilled nursing facility. He put money away for retirement, he had insurance, but it's amazing how fast money goes when you're having to spend it on health care. I so vividly remember the moment that he said, "This isn't the way it was supposed to be." And I'm sorry. I'm 64 years old, and I'm laying here in a nursing home, and this isn't what I wanted. But the story can change, and aging can be about having your choice and keeping control and living in your own home for as long as you possibly can.
A lot of the plans that are being put forward, right at the very forefront, are putting prevention there, and that's incredibly exciting to me.
I come from 4 generations of nursing. Right now, I believe that our health system, our hospital and insurance industry focuses on diseases and everything to do with diseases instead of prevention and wellness, instead of early detection and treatment.
If we focus on prevention and wellness and take care of your blood pressure with early visits and more visits to your doctor, then maybe we can prevent costly emergency room visits, heart attacks, intensive care unit stays. So it's better quality with low cost. So that's one fear that I hear a lot, that I won't be able to choose the doctor I want. As a matter of fact, if we stay with what we have now, and there are cuts to Medicare, there are some physicians may not be able to keep their practices open with proposed cuts, not in healthcare reform, but the way our system is now.
This year, left to its own devices, all physicians will receive a 21% pay cut from Medicare. More to the point, the following year, another 21%. So I don't see the problem getting better.
Now, if you're a doctor and you're taking a Medicare patient and you know you're going to be cut by 21%, are you going to take that Medicare patient? If you have an alternative, take another patient? No.
If we don't do anything right now, we're facing these cuts. We're absolutely facing the 21% cuts, which is really scary to the doctors and patients.
A lot of people ask, how can $500 billion be taken out of Medicare without affecting benefits? The answer is that there is tremendous inefficiency in the system right now.
Do you know how big this program is? In next 10 years, spend trillions of dollars on Medicare. And how can you take $500 billion out? It's not all coming out in cuts, it's coming out in savings. If you think we can't subtract 3% from 100% and make the program better, then we're not very good managers.
To be spending this much money and getting pockets of excellence, but oftentimes a lot of care that isn't well organized, and so many people end up falling through the cracks, and then because they end up getting destabilized, roll around and go right back into the hospital, and that's not good.
By having, standardized electronic medical records, again, the doctors and the patients can work together to actually get to what needs to be done for prevention, for diagnosis, for treatment sooner and more efficiently.
There is significant consensus that the efficiencies can be attained, the costs can be brought down, and this is simply necessary to preserve the program for the future.
Call your senator, call your congressman, write letters to the editors of the paper, tell your story. Everybody has a story. Tell your story.
The seniors are the ones that need to be out there, out front. They need to be saying, if you don't support reform in this country, we're gonna make sure we don't support you come election time.
Medicare is part of the whole system. It's in the mix. And if you don't improve the whole system, Medicare can't stand the way it is. This bill, in many ways, really helps Medicare. But if we don't do it, guess what? Our daughters and their daughters won't have health care, and they won't have Medicare.
It's going to strengthen Medicare. It's not going to weaken it. It's going to strengthen it.
Thank you very much.
Well, thank you. It's been my pleasure.
Yeah, come on, you can get on up.
Okay.
Give me a hug.